Yes, we can hear you.
Okay. So just introducing myself, of course, I'm graduated from Pakistan. I started my career in 2014. Interventionalist and heart failure, as well as structural heart disease. I started my career being academic. I will just tell you in short that I loved academia. It's not like I don't like academia, but I recently transitioned to more administrative role. I'm still practicing clinical medicine, but my role at this present time is more administrative. I was part of HCA before coming to New Mexico. I was basically the head of HCA CV program for Florida and South Georgia region. Now I'm basically the CV chair for not only the hospital in New Mexico, but I'm also for the whole LifePoint health system across US.
Thank you. That was wonderful. We go to Dr. Rizwan Khalid.
Assalamu alaikum, Waqas. Thank you very much for the invitation. I'm very glad that a bunch of people were able to attend on such a short notice. Rizwan Khalid, I'm from originally from Lahore. I graduated from Karachi, from AKU in 99. I went into practice in 2008, 2009. I think once we come to each, I can tell more details because I actually went to the Middle East and I practiced in the Middle East for 5 years before I came back. And I've been in university employed. I've been RVU, and recently 3 years ago, everybody can hear me, right? Waqas, you can hear me, right?
We can hear you. You just got mute. I'm sorry.
I think ये पता नहीं किस तरह हो गया. और दूसरी बात एक और चीज, this is very informal, and I hope everybody can understand Urdu, because I am going to speak not just in English. I'll just speak in Urdu as well. So now for the last 3 years, I'm a partner in an independent. It's an EP practice in North Dallas. As you mentioned, I was the president of APNA, the Central APNA in 2021. I've been associated with the association since 2004. I was the secretary in 2017, and I finished 2022 was my board of director position ended. I'm the chairman of medicine for Texas Presbyterian Health System, which is a big health system here in Dallas. Anybody who's lived in Dallas will know that this is one of the 3 big hospital systems. So I'm the chair here. And once we come back, then I can share some more stuff. Thank you, Ji.
Thank you very much. Dr. Arman Raza, if you can please.
Thank you, Waqas. Good to see some of you. I mean, I know a few of you already. I'm Arman Raza. I'm a cardiologist here in Houston. I did graduate from Dow Medical College in 2001. And did my training in medicine from Michigan and then VCU cardiology. And I joined this practice right out of fellowship in 2013. And I've been with the same practice since I joined. I'm one of the few, fellows who did not leave their first job. Most people do. So I just stayed with the same job. And I plan to retire from the same job, and we'll come back to it. Thank you.
I'll invite Dr. Hussain to go ahead. Dr. Hussain, you want to start, please? So the format will be, we'll ask a question and then each one of you can go over that, and then we'll just keep on going onwards. So Dr.
Perfect. So yeah, we can start with the questions, and each one of you guys, if you guys can, help us understand and answer, that will be helpful for the viewers. So the first question we have, thank you for the introduction, by the way, guys. So can each panelist briefly share their journey? And as we said that, we have current all 3 speakers in cardiology, because this was, this initiative is from a cardiology group. But as we move along, at some point, probably we will include other specialties as well and see and if they can share their experience. But today is mainly our 3 speakers are from cardiology for that reason. So anyways, can you guys share the journey into cardiology, including your initial career choices and factors that influence those decisions? If you guys can, answer that.
Are we going to start in the same order, Hussein, or how do you want to do it?
Yeah, we can do that. We can request Dr. Rizwan Sardar, and then we can go in the same order. I think that will just be easier.
Okay, thank you very much, Hussein, and thanks. Nice seeing all the panelists. I personally have never met any one of you, but thank you for this opportunity. So Waqas and Hussein, my journey is, as I said and alluded before, I was very driven to academia. I was very fortunate that I encountered my mentors who actually supported my journey toward academia, and I was very fortunate to work with in a job where they really foster my academic goals. I was interventionalist in structural heart disease by trade. Very early on in my career, I got a job which was in an academic center, very big university program. It was at Brown. And that really helped me because my mentor was not only helping me in just, procedures itself, but also were helping me with my academic pursuit, like, writing grants, research, and those kind of things. So I was able to secure the industry grant. I was able to support AHA grants. And later on, I went to Cleveland Clinic. And from there onwards, I kind of knew already that I have some administrative liking, that, how things work. And I just wanted to make sure that I get the best of my skills. So I was really recommended by my mentors to seek an opportunity to do MBA. So I did MBA also, but I never utilized it. Can you hear me?
Yeah, thank you. I just want to ask, here, what do you think is the importance of MBA for some of these graduating fellows and resident physicians?
Yeah. So Wakasa, that's a good question. At that time, I also was not clear what is the benefit of me doing an MBA. And to be very honest, they asked me to do an MBA in healthcare management and those kind of field. My brother is an accountant, and my father is also from the business side. I basically decided at that time, for no real reason, it was a very random reason, that I'm going to do MBA finance, and I have no idea how it's going to help me in the future. I'll be very honest with you. Sometimes things unfold in your career and then you realize it was a blessing in disguise. So kind of the same thing happened with me. After that, I went to Cleveland Clinic. I basically exposed to, like a world-class care that you can have. And I got an opportunity later on to become the program director, as well as structural heart disease program director, where I really was able to capture the skill that I learned from MBA, that how can I become a good administrator? How can I basically fulfill and understand the balance sheet, understand that, how the economics of healthcare work. After I was there in Ohio, then I decided to go to industry. I actually left academia. I wanted to know that how does healthcare industry work? And how does being an administrator job work? So I had a mentor who is in HCA still. He actually convinced me to leave academia, and he said that you should come to the different side of the world where you can become a physician administrator. I never knew what the physician administrator does, but I readily got to know that physician administrator is a very rare opportunity if any of the new grads or even the old graduates can have. They can make a difference wherever they work.
Right. So we'll move on to Dr. Khalid.
I was able to basically use my MBA skill, not only along with the clinical skill. And later on, just cutting story short, I was given an opportunity to basically chair the CV division for LifePoint Health System. And that's where I am, and trying to make the most of being a physician administrator.
Okay. So Dr. Hussain, your question was, I think in the interest of time, I think we'll ask one question and then just let every one of them to reply, because I think they're all equally qualified. We'll try to limit them. I think from Dr. Rizwan Khalid, I think, what were your challenges? Why did you go to Middle East? I think that some, a lot of Pakistani physicians के दिल में होता है, दिमाग में होता है कि maybe we might return to Pakistan, maybe we might go to Middle East. So if you can just shed some light, what were your thoughts? What were the challenges? Why did you come back? Okay, you have done both, and I know that you have done both. So
बिल्कुल I think सबसे important बात ये थी कि I did not want to I wanted to actually practice in Lahore, or that was the reason that I actually left. I finished my fellowship from Atlanta on June 30th. 2nd जुलाई को मैंने सारा अपना सामान भेजा लाहौर, और जुलाई 4th को I had my flight and then I used to call it that was my Independence Day. So left primarily to work in Lahore. उस ज़माने में वीज़as के काफ़ी issues थे, तो for 5 years I had not traveled outside the US. So interviews वगैरह कोई ऐसे नहीं होते कि you could traveling वगैरह कर सकें. तो I went to Lahore. I looked at quite a number of hospitals. मैंने काफ़ी I knocked a number of doors. There was no opportunity at that point in time. I had already had a backup job in Saudi Arabia, because my older brother, who's also from AKU, he was a year older than me, and he did ICU ID. He was already working in Riyadh a year before I went. So he had gotten me in contact with somebody. So I had already had a job lined up in Saudi Arabia, or kind of an acceptance. So when I went to Lahore, in 6 weeks, I knew there was nothing here as of now that would happen. But I did not want to come back to the US. So I went to Saudi Arabia. I worked in a very large hospital, 1,400-bed hospital, King Fahd Medical City, with 8 hospitals. It's a medical city, so it's 4 hospitals, 4 institutes. We had an independent heart institute for 200 beds, and I chaired 3 divisions there. And that was an excellent experience. I know there are a lot of people that will be interested, and I'll try to keep it short. I know हमारे 3 panelists हैं, and we have a bunch of stuff to cover. I worked in Saudi Arabia in Riyadh in King Fahd Medical City. I worked in Qatar at Hamad General Hospital, जो उनका सबसे बड़ा hospital है. And then in Abu Dhabi, I worked in Mafraq Hospital, which is one of the largest government hospital under Seha in Abu Dhabi. The other one is Sheikh Khalifa in Abu Dhabi. So I worked in Mafraq Hospital, which is now called Sheikh Shakhbout, which is now with Mayo Clinic in Abu Dhabi. In that time when I was there, professional experience was excellent. I really enjoyed in Saudi Arabia as far as professional development and professionalism is concerned. Personal issues वहाँ हैं जिसकी वजह से if anybody is interested, I can offline talk about. There are a lot of personal issues that you will face, especially my wife and family. क्योंकि ख़वातीन पे, now this is obviously for 13, 14, 15 years ago. लेकिन अब हालात are better even in Saudi Arabia. Professionally, I was very happy over there. Personally, not very happy. लेकिन benefit ये था कि I was very close to Pakistan. My parents were there. It was a 3.5-hour flight. And then when I was in Saudi Arabia, I started building my own hospital in Lahore. So, and that's a different story. We will discuss that later maybe. लेकिन मैंने बड़ा, I enjoyed at that point in time. I don't want to go into a lot of details because I think there were a couple of questions about salaries and this and that. I'll just tell you briefly, salaries are less than the US, but lifestyle is much better. And obviously it's much close to Pakistan, especially जिनके parents होते हैं. And there are a lot of minutiae, कहाँ जाना होता है, किधर. You only go to government hospitals, you don't go to private hospitals. You only go to the larger cities. आप सिर्फ Riyadh, Jeddah and Dammam. You don't go to any smaller cities. So there are a lot of things that we can spend an hour discussing the Middle East and non-US positions. But why I came back, मैंने 5 साल किया. My wife had just graduated when I was I had already gone to Riyadh. So she gave her exams and everything, and she came back for her residency. And for 2 years, I stayed there. I said, I'm not coming back. But when she went into fellowship, then I decided, we had one kid, and I decided, I think it's about time that I should come back. So I came back because of my wife and kid. So I'll stop here.
Thank you very much. I think at the end aapke addresses, phone numbers, we can share that so that if people have more questions, they can ask you the question offline. Dr. Arman Raza, you are running a very successful private practice. If you can please kind of go over, like, how did you start after the fellowship? How did you went deep into the private practice, and what were the challenges? So 3 cheezein basically, if you can address that. Thank you.
Sure. So when I was doing my fellowship, I had already seen the academic side, and so I knew I wanted to do private practice. I wanted to be independent. So I knew from get-go, that's what I'm going to do. And so I looked for the biggest city with the biggest airport, and Houston was number 1 on my list. So that's why I came. I joined a practice. There were 3 cardiologists, all much older than me. And actually, they had not made any partners since 1995, and I joined them in 2013. So it was a bit of a red flag, but in a bigger city, you don't have many options. But they're nice people, and I joined them, and I'm very happy I did. But soon after I joined, one of the partners left, and we were down to 3. And then we were competing with this other big group who had 13 or 14 cardiologists. And then we started growing, and we started adding more and more people. So in terms of volume, our volume was as large as some of the bigger groups in my region. And in terms of how to establish yourself, how to get referrals, that's the tough part, especially in private practice early on, because people have set referral patterns if you're going into established market. So sometimes you have to go out, do remote outlying clinic and so forth, which I started doing. I still do, actually. That has become one of my busiest clinics right now. I go an hour out of Houston, where I do an outreach clinic, and it's become so busy that I now have added 2 days now. But then you go out and market yourself. The biggest benefit is if you go out yourself and speak to your referring doctors, they tend to refer to you. And what happens is, all these people are very set in their ways, but when they see a new guy come in, so as a new person, you always have this advantage. People like younger people. There's a perception, and rightly so, that you're probably more contemporary in your management and so forth. So you start getting them, and you start to give good service to your referring doctors, and you make good referrals. And to be very honest, some of my biggest referrals have been the same ones I've had 10 years ago. And now I have a very busy practice, and they keep sending to me because I do the same thing over and over. I make sure my note gets back to them. There's something comes up, I respond back to them. The biggest tip is I never turn my cell phone off. Even it's only off when the air hostess tells me to turn it off. Otherwise, it's on in Pakistan, it's on in Europe, wherever I go. My referring doctors know they can reach me at any time, and I'll take care of the problem, whether I'm there in the US or not. So that's one thing I've learned. I'm so accessible to them. They know, if they can't reach anyone in my group, they'll reach me. So again, it can be a good or bad thing. Of course, my wife does not like it all the time, but that has really helped me a lot, being very, very busy in this part of the town. Also, I would say then bring the culture, the right culture to your practice. And that's what one of the challenges I had in my practice. We went from stagnant practice to a growth mode, and that required some of us working extra hours, long hours, more weekends than usual. Now, when I interview younger graduates, there's a lot of emphasis on lifestyle, which is fine, but it's dynamics are a little bit different when you're establishing a practice, especially when you're on partnership track. You have to put in extra work for a little bit less pay early on, but it pays huge dividends in subsequent years. So I'll just stop here.
Bakas, can I add a couple of things?
Please, of course. It's very informal, as you said.
बिल्कुल एक तो अरमान ने जो बात की है ना, this is on the spot. Accessibility, if you're going to go into private practice, you have to be accessible. Cell phone, whether you're on call, whether you're not on call, whether it's weekend, whether it's Eid, doesn't matter. You have to take care of your referring physicians. Very good communication, and once you develop a good referring pattern, then it goes on, and they will continue to refer, and you can become very, very busy. सवाल मैं अरमान से ये पूछना चाहूँगा कि what is the difference? मसलन, why would you choose private practice versus RVU? मैं एक line का जवाब देता हूँ, and फिर I want to get Arman's opinion. If you want to develop equity, if you want to develop something of your own, then you have to do independent practice where you have equity and you develop something of your own. You are your own boss. You tell when you're going to start, you tell when you're going to finish, when you take off. It's very simple. And this is the best thing that I feel that I have learned. I have done everything: university employed, hospital employed, fixed salary, RVU, and then private practice. I call my office manager and I say, जुम्मे को block कर दो, या मैं उस दिन नहीं आ रहा, या मेरी my daughter has something, I'm not coming, just change my patients to 9:30 or 10:30. That independence, if you are in my previous hospital system, 2-3 लोगों को जाके पहले जवाब देना पड़ता था कि जी क्यों कर रहे हैं, how will you make up, और ये there was something called a bump rate in University of Rochester. तो वो आपका अगर 5% से ऊपर bump rate हो जाए तो वो आपकी हाजिरी हो जाती थी. So I was sick and tired of that. I really did not want to be answerable to anybody. So it's हमारी collection based है. RVU में ये होता है कि भाई if you're uninsured patients वगैरह वगैरह you still get paid. But in RVU, once you leave that hospital, the next day you are zero, which means you have nothing, you have no equity, you have nothing जो आपके साथ जाएगा. In a private practice, you develop equity, and this is something that is very important for people thinking about private practices. Or we can go into that. Initial salary हमेशा कम होती है, but long-term goals की तरफ देखना होता है.
No, I agree with you, Rizwan, about the independence. I will not trade independence with anything. That's the only model I've seen, and I've seen other people like yourself and saying the same thing. As far as RVU versus collection base, which we have too, we don't look at RVUs. We started looking at it because surprisingly, some of the candidates we interviewed, they wanted to be employed out of, which is really bizarre. But some people wanted that model. We want fixed salary, we want weekends off, we want this, we want that, which was very odd. It's sometimes hard to explain. But the biggest issue, which I find with RVU, is somebody is dictating the thresholds, and then somebody is dictating how much an RVU is in each region, and then you are in a perpetual cycle of negotiation and renegotiation, which at most of the time is actually at the very base level you started off. So you're not really climbing, you're fighting every few years to get back to where you were when this initially negotiated your contract. So that's the issue with RVU. I find RVU is a tricky model. I think it favors the hospital institutions more so than it does the physicians.
Rizwan Sardar Bhaiya, if you want to address the question, we'll be addressing the question in the
chat
from the people. So yes, please.
So no, I think Rizwan and Arman both have actually said right. That's a way to look at things. Just to give a background, I have private practice experience as well, and I'm a part owner in private practices too in Florida. It's kind of a first that you need to set out is that what do you exactly want in your short-term goal and in your long-term goals. Everybody is not cut out for a private practice to get started off from. Like I just started off, I was very clear in my mind that I want academia. This is what I want, and I really pursued very hard. So whoever is graduating, for example, if they want to decide that I am going for J1 waiver, I'm going for a visa situation, I cannot afford to be a private practice. Hospital model is not a bad model. Remember, guys, when I'm giving all this, guidance, uh, please do keep in my mind that I'm a hospital physician administrator. Yes, hospital has a win-win situation, not always in RVUs, but there is a win-win situation for physician as well. You don't have to bear overheads of the practice. You don't have to worry about the practice is going to flourish or it's going to fail. There are certain parameters that basically dictate you to achieve those thresholds, but it all depends upon what kind of group that you're working with, what kind of people who you're working with. It's not always good, but you need to basically do your due diligence like you are joining any private practice as well. The pluses for hospital-based RVU models are, which I will just like to tell, you don't need to worry about your overheads. For example, you are coming out of fellowship. I mean, Arman has done a great job. Not everybody can do it. So you should know your limitations too, that whether you are cut out for these kind of things or you're not. In last but not the least, hospital can easily sponsor you a visa if you are in a situation of a J1 waiver. Finally, if you have a good group where people actually are run by a physician administrator like me, or there are some other hospital where there are physician administrator, you can actually do your own work-life balance according to what you want as well. I mean, I cannot speak on behalf of all the hospital, but I can certainly say that there are many groups, hospital employed, where people can achieve not only a good life balance, but they can actually make a lot of good financial stability in their lifestyle by working for the hospital, and not to worry about making the practice, making sure that you are paying the bills and everything. Last thing that I would like to address, the J1 waiver situation. I have not encountered that myself. I went through, the EB1, but J1 waiver is a very hard thing to do. And I think for that, the hospital-based system is the best way to go, and, develop contacts with the people who are already in job. I think I have posted in this group many times who are looking for J1 waiver. In the same way, please, if somebody's looking for J1 waiver, just please don't feel shy. Just post on this group that Hafiz and Wakas have started. There are plenty of people they would like to connect you if they don't have a job themselves.
If I may, there are a few questions about private equities, so I may just address it. So in Houston, there's a lot of activity from private activity, and there are quite a few practices bought by them. And we were actually very close to selling our practice as well, and we backed off in the last few weeks for good reasons. And actually, when you see it up close, you figure out what's happening. They say all the right things until you start seeing the contracts. So you have to be very careful. I'll cut it short. If you are within 5 years of retiring, then yes, you can do whatever you want. You can sell to private equity and this and that get done. But if you have more than 5 years of practice left, I will be very careful joining private equity backed groups. So that is really the bottom line. We can go into details. You can call me later on to.
So in relationship to that, so early career physician out of the fellowship, they are being offered these jobs in the private equity, and they're asking these questions that should they join private equity groups or not? What is your?
I mean, me personally, knowing in and out of how it works, I would not. Because the way the private equity, I don't know how many of you know how it works. They actually create equity for the existing partners, and they take a scrape. It's called a scrape. So what they do is they do your EBITDA, and they buy anywhere from 25% to up to 40% of your EBITDA times multiple, whatever you negotiate. So in other words, if you collect $100, they bought $30 from you for the rest of the practice, and they gave you a multiple, let's say 10, 15 multiples. They gave you $300 upfront, but that money went to the existing partners. So if you join, your income will be 30% less than what you collected for the rest of your life. So you've lost that income, and now of course they have buzzwords. They call it income repair. They call it this and that, and that's all. Part of them is actually true. They do bring better contracts to the table. They can have ASC and OBLs built for you. But then the thing is, if you're someone like us, we are doing that on our own. Why do we need them? So we looked at all those things and we said no. So you have to be careful. Now, sometimes you may not have an option, because I know in the Houston market, and I think Humayun is here as well, in the Katy area especially, a lot of practices have been sold. And if you're trying to go to Katy area, you may not have many options. So that's where it is. I think when the consolidation happens more and more, there may be limited options. But for now, if you have option to stay independent, that's what I would do.
I think regarding the private equity, I will just add one thing. I agree with Arman that there are private equity groups. They are basically buying the practice, but they're selling it again and again. This is happening in Florida. They are bought 1 year, 2 years down the line, they're sold again. So I personally think the private equity group, for somebody who's just starting up, they want to just taste the area, just to see that what area offer, it may not be a bad thing. But if somebody who's looking for long-term, the private equity may not be the best way to go.
I'll just add, be very careful with the non-compete. Some of the private equity firms, they are national firms, and non-compete is very, very ludicrous, to be honest. Now, of course, some people may say, it's not enforceable, but you really want to get into this trouble of hiring lawyers and those. So be very careful with the non-competes with these people.
Achha. Great insights. One question that I think I'm seeing here in the chat as well, and that always comes to my mind as well. I never had private practice, but negotiating with the insurances. Now, the organizations and these private equities, they have negotiated better rates because, they use the leverage. They are larger. They have more patient population, more physicians. As a private practitioners, how do you negotiate, and to what extent negotiate kar sakte hain with insurances, the rates and all that? What tactics do you use?
Was that for me?
For
sure.
Anyone.
एक चीज in single word, private equity, big no. कोई भी you should not join it. we should not mince words. उनका काम सिर्फ खून चूसना है. आपकी जिस तरह आप कलेक्शंस होते हैं और कलेक्शंस के अलावा आप कलेक्ट करते हैं, आपने अपना ओवरहेड देना होता है, बाकी पार्टनर्स के पास जाता है. If a third party comes, they are going to have their own share, so they will make you work harder to make the same amount of money. So private equity, if you can avoid it, please don't join them. Try there are a lot of other hospitals that you can work for. Coming to insurance contracts, there's a bunch of things that you can do. जिस तरह Dallas में एक चीज है कि there's something called a Southwestern physician resources. There's this bunch of large group of physicians that are contracted, और आप उसके as an independent practitioner, you can become a subscriber. You pay whatever, I don't know if it's $500, our office pays for it, and then you get the same contracts. You become a preferred provider or physician. I hate the word provider. So you become a preferred physician for them. It's on their websites and everything for their patients, as well as you get their contracts. इसके अलावा, you can negotiate your own contracts as well, and there is a lot of opportunities to do that. We have negotiated our own contracts, and we do reasonably well as far as that is concerned. और आपका क्या question था, Hussain? I forgot. Was there something else that you asked?
No, that was pretty much it that you answered. For new people who are starting new practices, are there any resources that they can consult to improve their negotiations?
So again, it's a long process, 2, 3, 4. There's a lot of things that need to be done. If somebody is thinking of starting a practice, obviously Arman and myself and others that are in private practice can certainly advise what is the step 1, step 2, step 3. Insurance ke saath credentialing, that takes 6 to 9 months just to get credentialed with insurances. Hospital privileges itna mushkil nahi hota. Stuff like, so there's a lot of steps, but we can really help you with those steps and take you there. एक और चीज कहने लगा था, लेकिन now I've forgotten. तो आप आगे चलें फिर अभी याद आया तो मैं बता दूंगा.
As far as the insurance rates goes, there are some groups like in Houston area. There's a thing called CVCP and there's MHMD. So if you're part of a hospital network, if you're part of a group, we can join these associations and you can have much better rates. I think some of the doctors in Houston area, they're familiar with these CVCP rates and MHMD rates. So depending on which location you're at, if you go to the hospital system, they have the negotiated rates. And the funny part is it's always difficult early on. Once you get bigger and bigger, you'll find out the tide actually reverses and you start saying no to the bad plans and you get picky. So you have to ride the tide, so to speak. And it becomes, that's why private practice is so exciting. You know, it gets easier and easier actually as time passes. You have less time, but actually the practice becomes easier in my view.
It's like a cruise control. Once you develop your initial 400, 800 patients, you are set for life. They are going to continue to come back. You are going to do an echo every year or 2 years. You're going to do a stress test based on symptoms every year, 2 years, 3 years. आप carotids कर रहे हैं ये वो तो like it is just a set thing. आपकी वो चल पड़ती है once you have an X number of patients. जो चीज़ मैं भूल गया था, प्राइवेट प्रैक्टिस में यू ऑल्सो डेवलप इक्विटी, यू डेवलप रियल एस्टेट. आप रियल एस्टेट इन्वेस्टमेंट्स होती हैं, आपकी इक्विपमेंट होता है, आप ओबीएल्स एएससी में पार्टनरशिप्स करते हैं. बिकॉज रिमेंबर द एक्चुअल मनी फाइनेंशियली is in facility fees. It's not in professional fees. Professional fees तो कुछ भी नहीं है. मैं आपको एग्जांपल देता हूँ. एक लूप रिकॉर्डर जो होता है, it takes 2 minutes to do a loop recorder. अब लूप रिकॉर्डर की जो आपकी आरवीयू है वो 1.5 होता था, अब उसका और भी कम हो गया. लाइक यू गेट $60 or something for that. The facility fee or the actual fee you can make almost like anywhere from 500 depending on the assurance to 900 per loop monitor. So, and if you do it in an OBL, so there is a lot of ways in which physicians, if they control their own destiny, and one of them ways is developing your own equity, real estate, OBLs, ASCs, many other things.
Very important. मैं actually कोई movie देख रहा था उसमें the person says के how are we going to make money on the burgers? He said we don't make money on the burgers, we make money on the real estate where the burgers are, because they are going to pay us. Real estate is ours, they are paying us. Anyway, एक और question, बहुत interesting question ये है कि how can you ensure that there's a clear pathway to partnership? I think the junior attendings जो हैं, they
So that's a very good question. I'll address it. That's a very good question.
If you can please.
I get asked this every year when we interview. So the most important thing is you look at the history. If you are interviewing at a place where there has been a huge turnover, they've not made partners for last 2 decades, then it's a red flag. You know, why would they make partner now? Whereas if you have a practice which is making partners every year, every 2 years, and there may be some attrition, there may be people who've left, that's fine. We've had people who've left us, but we've had a core group of people which stayed, and we have people on partnership track. And so you look for the historical pattern, and you'll find out. I did read for some of these comments. Can you ask them to show their books? I don't think anybody would open their books for you or give you any detail without knowing you at all. It's really a leap of faith. So you do your homework, look at the trend, and you have to have trust in the process.
Maybe IRS ke liye they can open the books, but otherwise they will not. That's exactly true. So Dr. Sheikh is asking, I think Dr. Rizwan Sardar can answer this question. What are the financial implications of going into academic versus a pseudo-academic versus a private practice?
So, there are a lot of financial implications. If you are truly academic, I don't know any true academic place which pays really good. I'll be honest with you. This is why I said you need to decide your goals, what you want. If you want to be truly academic, writing grants, doing publication goals, publications are tied into RVUs, don't expect too much financial reimbursement to you, or like good financial model for you. But if this is what you are satisfied with, that's actually not a bad thing. I'm not trying to basically say that you should only look at financials. I decided to choose that path. I was very happy. I was very contented. I changed my path because that is what I felt I should change in my life at that time period. And I have no regrets about it. Pseudo academics, I know a lot of places which are pseudo academics. Again, those places are basically so called they are academics. I've seen some of them are very successful financially, some of them are not at all successful, because a confused person is never successful in my books. If you are really truly academic, you should basically seek those goals. If you want to be pseudo academic, as the name suggests, you will be confused, your financial planning will be confused, and the person who has hired you, he will be abusing you, or she will not know exactly what to use you for. Use you for research, use you for teaching. Are they paying you for teaching? They're not paying you for teaching. And in the end, when you are so confused, you don't make any good financial decision or financial model. It is better, if that is the kind of a model that you are choosing, it's not a bad idea to either become fully hospital employed, non-teaching, non-fellowship, non-research, versus just go to the private practice.
I'll just say I am one of those pseudo academics. Okay, and I'm actually very happy. I have the best of both worlds, and I did not plan it this way. I knew exactly what I wanted to do. I wanted to do private practice, and that's where I was. It just happened that 5-6 years into my practice, we started having a residency program. I became co-faculty, and then we started a fellowship program this year. I'm a co-faculty there as well. So now I have established private practice, and I have residents fellows who work with me. I'm thinking about cutting down my clinical work to focus on teaching, which I enjoy, to be honest. So you can be in that position and be very happy, which I am. But I didn't plan it that way. It just happened. So you should never shut down any doors. You may end up being in a place where they may start a fellowship, especially the SCA programs are very aggressive with starting the GME program. So I am in one of the SCA hospitals, and that's where it's happened. So you can have, best of both worlds sometimes.
Dr. Amin is also here. Dr. Amin, I don't know if you would like to chime in a little bit.
Assalamu alaikum. Are you talking to Amin Karim?
Dr. Amin Karim, sorry.
I've been listening very intently. I was actually, forgive me for that, but
American style, you're Dr. Karim, but in Pakistan, you're Dr. Amin. But yeah.
Thank you, sir. You can call me by any name. But basically, I have to confess that while I was listening, I was also reading my echoes. So being multifunctional and in private practice. So anyway, I won't go into much detail, but I'm actually writing down a whole series of articles. I've finished almost 2 on my website. I've got a new website that I'm filling up now, making my own website, and I'm actually tracing my journey, as it were, from the fellowship, which I finished in 1987. And the striking thing is that I finished fellowship on the 30th of June. On the 1st of July 1987, I was in my own private practice with my own office. So those days were different. Those were very different era, where we had mostly indemnity insurance, Medicare, no PPOs, no HMOs, and they paid very, very good reimbursements. So we were lucky. Established the practice took me a couple of years, and all these details are there as to what was my decision tree, what was my checklist, how I starting from almost nothing in the bank, and established and how much of moonlighting and extra things I had to do, and how many hospitals I had to go to, and how we established the referral patterns and so forth. Just like Raza Arman said, but Raza, of course, is in a different time frame. Going backwards, it was a little different. But Allah shukar hai ki, eventually everything worked out, and we established a practice. And just like Rizwan said, that once the dukaan chalti hai, to phir dukaan chalti rehti hai. And there are a lot of opportunities come that you benefit from, you learn, you become half a businessman. And that is the biggest advantage. And like Rizwan said, you build your equity, you learn to manage, you learn to do all kinds of things, like, from becoming a purchasing manager to a personnel human resources manager, to making, looking at your payroll, you looking at your bank statements, etc., etc. Anyway, so it is proved to be quite a journey. Mashallah, it's now 34 years, and I look back. I won't. If I had a chance to do it all over again, like somebody said, I would not change anything. There was an ample opportunity for me to go into, because I was in the medical center, and there are mega institutes, Texas, University of Texas, Baylor College of Medicine. They all had opportunities to very easily go into them. And the colleagues who graduated were Dr. Neil Kleiman was my class fellow in the interventional program. He chose to go into academics, and he's still the director of the cath lab at Methodist and a very good friend. We get along very well. So he chose a different path, stayed there, and of course he's doing okay. He's happy where he is, and I'm happy where I am. And Raza, like Raza said, there was an opportunity came to people to us in Methodist to jump into bigger groups, just coalesce into bigger group with their own cath lab. I resisted that and stayed away. And now the other opportunity came to go into this venture businesses, which I also stayed away. Most of my other, and the only other thing was in solo practice is the coverage things and all that, where you have to seek out other solo practitioners to cross cover. And there also I was lucky, Dr. Attar and Dr. Masroor Khan and Sonia Jacob and all these people. We are all solos, and we all cooperate with each other. We are like back catchers. If somebody goes in the middle of the night, calls me, hey, I'm leaving town, cover for me, no problem. So we do that. Anyway, so that was in short, my journey. And like I'm with the group that says votes for private practice.
you have a probably if you can share your website, it will be great. Or basically what we were trying to achieve were introducing the resources, and I'm sure all of you will be more than happy to help our younger colleagues in the group. Please reach out to them, and agar aap apne emails ya jo bhi contact information, if you can share in the chat, that will be great. Dr. Akhtar, Yasir Akhtar, I don't know if you want to, so we're ending reaching towards the end. So Dr. Yasir Akhtar, aap kuch apna batana chahenge? Dr. Yasir Akhtar has been also an APCO graduate. First was in a private practice, and then he went on to make his own private practice. If you can please say something, give some advice.
Assalamualaikum, Vikas. Thank you so much. I was hospital employed for the last 10 years and jump shipped because for many of the reasons already mentioned, that I wanted independence. I was sick of administrators, treating our nurses wrong and treating everyone wrong. So, we tend to think we can do everything better, and that's true. We can do everything better. I also had the vision of starting our own lab and OBL and whatnot. So it's been 1 year, and alhamdulillah, the best decision of my life. And it's growing rapidly. If anything, rather than I was more interested in figuring out how do you grow a private practice. I'm a solo practitioner, and I need help. I need recruits. And how do you? One question I wanted to pose to the panel was, how do you recruit, and what type of partnership incentive do you give people? Like as someone who's independent, I want to be fair. I don't want to hire and enslave a new recruit for the rest of his life. What type of incentive package do you give, and what type of partnership model do you give your new colleagues who come out?
Let me take this, and Humayun also asked the same kind of question. How do you identify when your practice is moving from startup phase to a mid-sized practice and so on? So let me tell you, if you try to sell anything other than what you have, you can have a very hard time. And we tried that. We tried that not because we wanted to, because we were in a position, we are dealing with some partners who were nearing retirement and so forth. So we are trying to sell something which is other than what we have, and we had a very hard time. So the best way to do it is to have something equal. if you offer them equal partnership, what you have, you will find good candidates. And then you have to make sure you pick the right person who shares your ideology and grows with you. That's very, very, very important. And that may require you to interview quite a few people. The good thing is most people who do cardiology, interventional cardiology, they have same kind of mindset, especially if they're immigrants. So you'll have the same mindset, hopefully. So you can find the right thing, but don't try to sell them anything less than what you already have, because it's not going to go well. How do you identify if your practice is moving from startup phase to mid-career practice, like Humayun asked? It just happens. You just don't know. Just if you're busy, people like you just add someone like yourself, and they will grow. And we had these issues when I was, a bit younger. I had a problem hiring new people because I said maybe it will cut down my cases. It did, but you know what? It's not a big deal. It did cut down a few cases of mine here and there, but in the end, your network grows. So you throw a bigger net. So don't be afraid of expanding if you think you can, and you will. If you feel like you can hire another person, that means you're ready.
Waqas, if it is okay, if I can just quickly say about structural heart disease.
More than that, please go ahead.
Yeah, structural heart disease jobs are not easy to find. I'll be honest with you. I think I graduated very early in 2014, where it was very easy to find structural heart disease job. Maybe I got lucky. But these days, structural heart disease jobs are not very easy to find. If you are doing structural heart disease, this does not mean that you are making a wrong decision. You are passionate about it, go for it. But network well to find a job where somebody can mentor you. You should not be the only solo person who's practicing over there. Second thing about structural heart disease is this, or even coming out as an interventional cardiologist, please diversify yourself. Still read echoes, still do some non-invasive or general cardiology work to make sure that you are still in the skill set. If you are only going to label yourself that I'm interventional cardiologist, I'm peripheral, I'm EP, then probably the life is going to be very difficult, whether you're private practice, whether you're hospital employed. I'll be happy to help anyone who's looking for structural heart disease job. I know a lot of people in this field.
Well, that was wonderful. And I think we should wrap up. It's about an hour. Well, thank you, everybody, and especially our speakers. And thank you, Waqas, for putting this whole meeting together. It's definitely, I hope our attendees benefited from it. And we will continue these sessions, choosing different topics, bringing different speakers. I think it will be a great networking as well as educational event that we can continue doing it. We can decide about the frequency and different specialities and all those things as we go. This was a first a session, and I think it went pretty. I learned a lot of things, and thank you so much, guys. Thank you for the time.
Thank you.
Because, do you want to add anything?
I'll just say that the first session is usually the worst session. It gets better from there. But I think everyone mentioned about their background, and we were able to accommodate quite a bit of panelists this time. But please share your access, like people can reach out to you if they have any particular questions. Mainly it was more of an info session for everyone. And inshallah, we'll bring back maybe another Monday night, and whenever everyone is available, we can do this. We had almost 60 people today, which is pretty good number for sessions like this. I would like to do a little bit more finances, and which people are interested in. They have been asking me direct questions on the next session, if we can talk about that in the next time. Thank you so much, Dr. Sardar, Dr. Khalid, Dr. Raza, Dr. Karim, and Dr. Akhtar, and everyone else. Thank you so much. And Dr. Hussain, you have been wonderful in collecting all of these people together. So thank you.
Thank you, guys.
Thank you, Ji.